Good day, everyone. This is case study analysis for the subject Advanced Microbiology and Parasitology to be presented by Christopher A. Celiz and Sir Jeffrey I. Ylagan, presented to Dr. Freddie Rose Ivan Pinar. And our topic is about dengue fever outbreak in Cavite, Philippines. So this is our team, the people behind the case study. I, Sir Christopher A. Celis, and my partner here, Sir Jeffrey I. Ilagan. For the introduction, this case study examines the challenge of dengue fever outbreaks in Cavite, a densely populated province in the Calabarzon region of the Philippines. Dengue fever, a mosquito-borne viral illness, poses a significant and recurring public health threat in the Philippines. And Cavite is among the provinces experiencing a substantial disease burden. This study will delve into the factors contributing to dengue transmission in Cavite, analyze the impact of the disease on the local population, evaluate current control strategies, and propose evidence based solutions for more effective management and prevention. The pathogen involved is the dengue virus. For our research overview, starting with the background information, dengue fever is caused by four distinct but closely related serotypes of the dengue virus, which are the DEN V1, 2, 3, and 4, belonging to the Flavivirus genus. Infection with one serotype does not confer immunity to the others, and sequential infections can increase the risk of severe dengue. The virus is transmitted to humans through the bites of infected female mosquitoes, primarily Aedes aegypti, and to a lesser extent, the Aedes albopictus. These mosquitoes typically breed in stagnant water found in artificial containers and natural receptacles. In Cavite, dengue outbreaks can strain healthcare resources, lead to economic losses due to hospitalization and lost productivity, and cause significant social disruption and anxiety within the affected communities. The impact is particularly significant in vulnerable populations such as children, the elderly, and those with underlying health conditions. For the key issues, we have here six. We start with the high vector density, in which Cavite's tropical climate, rapid urbanization, and inadequate water management practices create favorable breeding grounds for Aedes mosquitoes, leading to high vector densities. Urbanization and population density, where densely populated urban areas in Cavite such as Bacoor, Dasmariñas, and General Trias facilitate the spread of dengue due to increased human-mosquito contact. Water shortage, water storage practices, where common practices of storing water in containers due to unreliable water supply in some areas provide breeding sites for mosquitoes if not properly covered. For the climate change, changes in rainfall patterns and increased temperatures associated with climate change may expand mosquito habitats and prolong the transmission season, potentially exacerbating the problem. Healthcare access and seeking behavior, where it delays in seeking medical care or limited access to affordable and quality healthcare, can increase the risk of severe dengue and complication. Lastly, the public awareness and community participation, where inadequate public awareness of dengue prevention measures and low community participation in vector control can hinder efforts to reduce mosquito population. Next, we have the current strategies. This is where the Cavite Provincial Health Office or the PHO and local government units implement several strategies to manage dengue. For vector control, we have larviciding, where application of chemical insecticides to water containers to kill mosquito larvae. Adulticiding, fogging or spraying with insecticides to kill adult mosquitoes during outbreaks. And lastly, source reduction, eliminating mosquito breeding sites by removing or covering water containers, cleaning gutters, and properly disposing of waste. Next is for disease surveillance, monitoring of dengue cases through the Philippine Integrated Disease Surveillance and Response System to detect outbreaks and track trends. For the case management, provision of clinical care for dengue patients in hospitals and health centers following Department of Health guidelines, and emphasis on early diagnosis, fluid management, and monitoring for complications. Lastly, in health promotion, Cavite do public awareness campaigns promoting the DOH 4S strategy, which are search and destroy breeding sites, self protection, seek early consultation, and support fogging, and distribution of information materials, community health education sessions, and media campaigns.
Okay, for the problem identification, so the core problem is the recurrent and potentially increasing incidence of dengue fever outbreaks in Cavite, leading to a significant public health burden. This is characterized by seasonal surges in cases, straining local healthcare capacity, and causing economic and social disruption. So the persistent threat of dengue in Cavite is driven by multiple root causes across environmental, social, and systematic level. Environmentally, Cavite's tropical climate allows Aedes mosquitoes to breed year-round. Rapid, unplanned urbanization has worsened drainage systems and led to water storage practices in scattered containers that become breeding sites. From a socioeconomic perspective, poverty and lack of access to pipe water force residents to store water, while poor waste management contributes to stagnant water collection. Public health system limitations, including insufficient manpower, funding, and gaps in data analysis, further weaken outbreak response and vector control. So for the community behavior, it also plays a role. Many residents lack of awareness of preventive practices and there's low participation in cleanup efforts. Finally, delays in outbreak detection and response give the virus time to spread, increasing cases and the risk of severe illnesses. So, for impact assessment, dengue outbreaks have a major impact on both health and society. They cause a significant illness, hospitalizations, and even deaths, as shown by provincial data. So these outbreaks strain in healthcare system due to the cost of treatment and testing. Economically, they lead to lost productivity and can hurt sectors like tourism. On a social level, dengue disrupts daily life, causes fear in communities, and places pressure on families. Dengue outbreaks pose serious public health and socio-economic challenges. In terms of morbidity and mortality, these outbreaks often result in a high number of cases, many requiring hospitalization and some leading to fatalities, especially among vulnerable groups like children and the elderly. Provincial-level data on incidence, hospital admissions, and death rates highlight the severity of the issue. So the disease also puts a heavy strain on the healthcare system. Resources are diverted to manage dengue causes, leading to increased spending on hospital care, laboratory tests, medications, and manpower. During peak outbreaks, hospital capacity can be overwhelmed, affecting care for other conditions. From an economic perspective, dengue leads to lost income due to missed workdays and school absences. Business suffer reduces productivity and local economies, especially to those reliant on tourism, can face setbacks due to health-related travel warnings or fear among visitors. In terms of social impact, dengue outbreaks can disrupt community life. Families are burdened financially and emotionally, and fear of infection can cause anxiety, stigma, and reduced participation in public activities. In some areas, recurring outbreaks also affect public trust in health systems and local governments. Initially, the overall impact of dengue extends beyond health, affecting the economy, social stability, and the quality of life within the communities. So the current efforts to combat dengue show both progress and challenges. On the positive side, The 4S strategy, which is search and destroy, self-protection, seek early consultation, and support fogging, offers a clear and structured approach that is widely promoted by health authorities. Vector controls efforts like larviciding and fogging help reduce mosquito populations, especially during the outbreaks, while the Philippine Integrated Disease Surveillance and Response System, or the PIDSR, supports timely monitoring and response to dengue cases. However, these efforts face several weaknesses. Sustained source reduction is difficult without continuous community involvement. There is also a heavy reliance on chemical insecticides, which possess risks such as mosquito resistance and environmental harm. Fogging, while visible and reassuring to the public, often offers us only short-term relief and may not effectively reach hidden breeding areas. Moreover, public awareness campaigns do not always result in long-term changes in behavior. During major outbreaks, healthcare facilities may become overwhelmed, leading to strained services and compromised patient care. There are also critical gaps in current strategies. Of course, there's limited integration between vector control, clinical management, and health promotion efforts, which weakens the overall impact. Some regions lack real-time surveillance tools or predictive modeling, which are crucial for early outbreak detection. Additionally, community-led initiatives often suffer from inadequate funding, training, and logistical support, reducing their effectiveness and sustainability. So this is the data. The table 1 represent 10 areas in the province recorded more than cases of dengue. And here, from the Imos, Bacoor, Dasmariñas, General Trias, Tansa, Cavite City, Naik, Rosario, Kawit, and Carmona City. So this is the figure 1 dengue cases in Cavite, Philippines as of February to January 2025. So out of the total number in the whole province, 33 or 1% were described as severe cases, 2,126 or 63% had warning signs, and 1,220 or 36% had no warning signs. So this is the pictures of Paging Mesquite. And for the conclusion, dengue fever remains a significant public health challenge in Cavite, Philippines, driven by a complex interplay of environmental, socioeconomic, public system, and community behavioral factors. So the province experiences recurrent outbreaks that strain healthcare resources, cause economic losses, and disrupt communities. While current control efforts including vector control and health promotion have had some impact, they face limitations in achieving sustained and effective dengue control. To address these challenges, a multi-faceted and integrated approach is needed. Key priorities include enhancing vector control strategies with a focus on long-term sustainability and community engagement, and strengthening disease surveillance and outbreak response system for timely and effective interventions. Promoting community empowerment and behavior change to ensure sustained participation in dengue prevention, and ensuring that health systems have the capacity to effectively manage dengue cases, particularly severe manifestations. So the potential role of dengue vaccines should also be considered in line with national policy. Collaboration among government agencies, healthcare providers, researchers, and communities is crucial to reduce the burden of dengue and improve the healthcare and well-being of the population in Cavite. So thank you so much. My name is Jeffrey Ylagan, my student. So this will be our case study together with Sir Christopher A. Celiz. Thank you so much po.